My name is Andrea Haferkamp.
And I'm Amanda Braun, and this is our bathing a patient video.
First, we'd walk in by telling the patient that we're giving them a bed bath and explain the procedure with them and ask their name and date of birth.
And make sure that we have washed our hands before we came in. Then we make sure that we have all of our supplies out and ready.
And we raise the bed so it's at our level to work on. And we will lower the rails. And start by putting the bed blanket on them for privacy.
We would also close the curtains if it was appropriate and necessary.
Right. Here's the washcloth. We'd make the diamond shape and make sure to rotate our washcloth, dip it in the water, and then make sure to go from the inner corner of the eye to the outer corner and ask if they want soap for their face.
But make sure we don't use any soap when doing the eyes.
So he said no, so we're just gonna wash their face. And this is also rinseless soap.
And make sure to get behind the ears
and the neck. And then when we're washing the arms, we have to make sure to go from distal to proximal to provide circulation for the body. Making sure to do the armpits last. And then after doing that, we would change the water. Make sure to dry their arms good. And apply deodorant. Next, we would wash through their abdomen. Straight their chest. And then if it's a female patient, making sure to get underneath the breast and lifting the tissue as well. And also dry off the patient. Next, we would be doing the legs. And then also with the legs, making sure to go from distal to proximal. And doing the feet last. With the Then after you do the feet, you would change the water again. And then we would have this. We would wash the back of the patient. This we make sure to start up at the back. Wipe the shoulder blades, and then get the bottom as well as the upper thighs. Get in between the gluteal folds, and then if male, also get the testicles back here, making sure to rotate the washcloth with each motion. Also make sure to dry the patient, which I forgot to put the towel down. And then I dry the patient really well. We would raise their legs to go in supine lithotomy position. And probably change the water as well, just so they're getting clean water.
And if it's an uncircumcised male, making sure to pull back the foreskin and get that very good. And then replace it back. And going from the tip to the back. Making sure to rotate the towel to keep clean, and then dry it.
Press his legs down, and then cover them up again.
And we, most of the time, would have changed the gown also during this process.
Right.
And we would put this in the laundry.
And make sure to raise the bed rails. And lower the bed as well.
And then we would make sure that the call light was right next to them.
And I'm Andrea.
And I'm Amanda.
And this is our our bathing video. Thank you.